What I'm going to try to do is operationalize some of the issues that you have heard discussed before, of making a rational decision about being in a clinical study or not. And you can see I've been all around, not only as a patient in a study, but also an investigator on a study, as well as a member of one of those IRBs that supervise clinical trials. So on the second slide, the next slide, I would give you my general rule as a scientist and a generally analytical person, and that is, in order for me to decide whether to participate or not, I'm going to rationally assess potential for harm and the potential for benefit and figure out whether that's appropriate. And you can see I use the word "but," which reflects the fact we don't know a lot of going into trial, because if we did that a drug worked, if we didn't know that a drug worked, it wouldn't have to do the study in the first place. So let's talk about the potential benefits. You've heard about that before. You might obtain access to a novel, potentially effective treatment. Remember, potentially effective. You might get access to additional clinical testing, clinical care, and you obviously would be altruistic enough and contribute to the general knowledge. And then I have a whole bunch of slides that deal with the potential risks. The first one is related to the way the studies are designed. As you've heard before, a lot of them involve the treatments is a known to be ineffective treatment called a placebo, a look-alike, smell-alike, taste-alike. So that's something that you have to consider. You also have certain medications that you may not be able to continue to take as you just study, and you want to make sure that you understand what happens after study, whether you continue to have access to treatment or not. Then there are risks associated with the procedures that are involved in the study. You will have a lot of confidential information that may not be confidential. You might be subject to genetic testing, and that's something that you are not willing to do. You're going to be poked, and you have to decide whether you're willing to do that. Related particular treatment, if your study involves an experimental treatment, is obviously the issue about the effect or side effect that we don't know about and any cost there. On the next slide, before you even decide about participating, you should, first, as I listed here, the investigators that offer you the study, and families, and most importantly, the treating physician that you have a long-standing relationship with. And you should ask questions, and that's what the next couple of slides is. Who is the sponsor? Who are the investigators? And who is the IRB, which is an outside organization that if you have any concerns about the conduct of the study that you could contact short of going directly to the investigator, whether the study involves any new treatment. We call that an interventional study, where something is done to you in treating your myasthenia or not treating it. Or whether it's an observational study where all that's happening is you're being observed, maybe a complete surveys, and those surveys then are used to assess. As far as the treatments are concerned, you've already heard about this placebo. What are the chances that you get it? Lots of times it's 50-50. Sometimes it's 2-1, as you heard for the Regain study. You want to know whether the study is blinded, whether you and or the investigators actually know who is getting what, or whether they are blinded. That means only in emergency would they be able to tell you what. You want to know whether the treatment that is, if it's a treatment study, whether it's approved by the FDA, which typically means you know a lot about it, or whether it's new and investigation, in which case you know very little about it. And you want to know, are there any alternative treatments that would make you change your mind if you knew about it? On the next slide, there are lots of activities, meaning inconveniences, that affect your quality of life related to studies. You want to know how long does they last, how many visits, what do those visits involve, how much traveling is involved, and then what happens if the study gets stopped prematurely? Is there going to be a follow-up, and what's that follow-up entail in terms of any additional exam? And lastly, you want to know something about the cost. You're going to pay for anything that you wouldn't normally do that is related to the study. Who's paying for the treatments or the study procedures? What happens if you experience any side effects that require hospitalization or you seeing a doctor? Pay for that. And sometimes if the study involves a lot of traveling, lots of time commitment on your behalf, you might be given a stipend, so you want to know that up front. And then lastly, you want to know what you should be doing in case there's a medical emergency while you're in the study, whom to contact, and you want to know who has access to all the information collected, because that is all private health information, and you want to make sure that you understand whom that information will be shared with. So let me wrap it up because my 10-minute myasthenia break is running out. So what you need to understand in order to make a rational decision, you need to know what's known. You need to know what's known to be unknown, and then you need to appreciate that there's always something that you don't know, to use our former Secretary of Defense, Rumsfeld's lingo. And you need to know that about the benefits, you need to know that about the harm. And then you use your own preferences, your own values to make a decision whether you should or should not. However, I do want you to appreciate and understand that without any of us myasthenia patients participating in clinical trial, we would not be able to understand myasthenia because it's a rare disease. So it's very difficult to reach patients in the first place. It would be impossible to develop new or improve existing treatments without patients willing to participate. And this might be that more and more relevant, newer treatments would not by the FDA or would not be reimbursed by insurance companies. So keep that in mind. So those are altruistic reasons, but keep that in mind as you decide about participation of clinical studies or not. And then my last slide is kind of a handover to John, who is going to review with you the clinical trials Gulf side, where you can out a lot of ongoing that requires patients. And I appreciate you listening to me. Thank you.